Okay, recently I went to an exercise workshop and we spent a couple days going over mobility, stability, some strength, and breathing. And yes, if you're not familiar with breathing, it's become a lot more popular in the last several years. And breathing, you should be able to fill up all these different areas of our ribs, and to breathe properly, we should be able to get air into a lot of different areas. But breathing activates your deep inner muscles, your inner core. If you're not familiar, people think of core, often they think of the six-pack muscles, the obliques here on the sides. You see in a very lean individual. And those are the superficial muscles, that's your outer core. Your inner core are your deep muscles. For example, your deep abdominal muscle, your transverse abdominis, runs this way, and some people refer to it as your inner weight belt. Important for stabilization, your inner core, but also your diaphragm muscle, which is just underneath your lungs, and kind of fills up a lot of the rib area. That's your primary breathing muscle, very important for core stabilization. But also, you've got your multifidus muscles, which kind of run along your spine, go from vertebra to vertebra, and they're a little more deeper muscles, very important for spine stabilization, but also your pelvic floor. So basically your pelvic floor, your pelvis is shaped like a bowl, and at the end, so that's the bottom portion of your inner core, and your diaphragm is dome-shaped, kind of parachute-shaped, just directly above it. So basically, when you breathe, and deep diaphragmatic breathing, you push air, goes into your pelvic floor, and use all these different muscles inside to work with the ones that are on the surface, the ones we usually see in a bodybuilder or so forth. So instead of just talking about it, I'm going to show you a different couple things you can do. And I've taken a lot of breathing courses or related stuff before, and this gave me a new aspect, and it's improved my own it's improved me just within the last 2 weeks. So instead of talking, I'm going to show you. Okay, so I'm going to start here, knees bent. So the first thing we're doing is going to go over belly breathing. So I'm going to put one hand here, just below my belly button, one hand here on the chest. So as I breathe a deep inhale, I should be able to see and feel my stomach rise and fall. So I'm going to take a deep inhale through my nose, and ideally I want to get at least 3 seconds, but ideally longer than that, 5, even up to 10 seconds, which takes a lot of work to get to that point. But then I'm going to do a long exhale where I'm going to blow through a partially closed mouth, and then that kind of pressurizes everything internally, gets those internal muscles working better, but also the longer the exhale, that's good too. So I'm going to try and get a longer exhale than my inhale. I'm going to start off here. Okay, another deep inhale, see my belly rise. So you can see a long exhale, ideally a longer exhale than inhale, but we want both of them ideally to be, 5 to 10 seconds. And having your mouth partially closed like that, so your mouth's not wide open but not fully shut, and that helps pressurize your internal, your internal core muscles, get them working properly, helps you exhale more of your breath that way. So I'll just do a couple more. I can do that for 2 to 3 minutes, but I'm going to move on to my lower ribs. So in this case, I'm putting my hands at my sides of my lower ribs, and I want to breathe into my hands. I want to expand my rib cage laterally out to the side. So I don't want to just be able to breathe through my belly. I want to breathe laterally through these lower ribs, but also want to breathe through the chest. I want to be able to breathe through all the different areas here. So that's different. My ribs expanding this way instead of just my belly rising. And now I'm going to do what they call an elevator breath. I'm going to incorporate both of those. So I'm going to start with the belly breath, then I'm going to expand out of these ribs here. Again, belly breath first. So again, start off with the belly, then expand into the ribs. Once more. So again, I'm kind of exaggerating that exhale, and ideally when you're exercising, especially at the lower levels, you're not going to hear your breathing. And so you don't want to do all your breathing this way, but this does help really activate those inner core muscles, get those, particularly your diaphragm, your transverse abdominis, getting them working well, and then you can go on from there. So ideally when I'm exercising, and just say I'm just doing light cardio, I really shouldn't be here. You shouldn't really hear my breathing, especially if I'm just sitting there doing nothing. You shouldn't hear me breathing. So there again, I'm doing all this, get all these muscles working, get a lot of airflow into various areas, which actually helps with your stability and mobility overall. And I'll go into that later. But okay, so now what I'm going to do, I can do a bridge here, and I'm just going to go ahead and bridge up. So I'm not trying to push as high up as I can go. I'm not trying to arch my back. I'm just trying to go as far as my hips will go without forcing them. Then I'm just going to hold this bridge position. And now in this bridge position, basically it's very easy to fill up my chest, fill up my upper rib cage with my breathing, as you'll see. There again, I'll hold this, 2 to 3 minutes, and hey, your glutes are, getting a decent workout just holding your body weight up during that time. And then after I do this, for a little bit, then what I can do, then I can have the elevator breath where I go up. Now I push my quads to the ceiling, I get a really strong glute contraction. So there again, this is the way I'm not just working your core, working your glutes, which work with your core, where your glutes are, they're a very important stabilizer for your pelvis and the base of your spine. So your glutes being strong and stable is part of a good overall strong, stable core.